Well, the dramatic escalation in restrictions introduced here in the UK was prompted partly by research from a team at Imperial College London, who described this as the worst respiratory virus since the Spanish flu pandemic in 1918-1919. They warned Britain was on course for a catastrophic epidemic and that the number of deaths in the UK could reach 250,000 unless there was a new approach. Here's our science editor, David Shukman.
From the start of the outbreak in Wuhan, there's been a huge research effort behind the scenes. Scientists using every detail to develop a computer simulation of the disease, what's called a model, and it's what the British government's initial response was based on. But then came northern Italy, where more people need intensive care than anyone expected. So the forecasts have had to be adjusted. What the scientists realised was that as many as 250,000 people could die of the virus in the UK, unless policies here changed. They now hope that'll fall to 20,000 with the new measures announced yesterday.
There's new data emerging from Italy and now from our intensive care units here in London to suggest that the level of treatment that's required for a small fraction of these cases is more intense than we thought.
We keep hearing about the modelling of the outbreak, but what does that actually mean? Well, it's basically maths, calculations about different factors that influence the disease. This model was for Wuhan to work out the rate of infection. It's how scientists quickly found out that on average, every person who gets the virus can pass it on to at least 2 others. So over a month, one case can lead to more than 200. China has responded by closing off entire cities. Other countries have done the same. But until now, the UK has kept the most drastic measures in reserve. So critics have questioned the modelling of the outbreak in Britain. But the scientists doing the work say it's better than nothing.
Models are not crystal balls. They're better than just guessing, which is what you would otherwise have to do. But they're reliant on the data we feed into them, and there is lots we don't know about this virus. There's also lots we don't know about what the effectiveness of these interventions really will be.
So how effective are these computer models of the outbreak? Well, they have to rely on a lot of assumptions about things that aren't known, such as if people have the virus but don't show symptoms, how easily can they pass it on? And then a really critical question: if someone's been infected with the virus and then gets better with a full recovery, is it then possible for them to get it again? Chinese television reporting on research into a possible vaccine. That won't come soon, but it's part of a frantic search around the world to understand the virus and to minimise its impact. David Shukman, BBC News.